Hello everyone. We are going to develop the topic of fibromyalgia. It must be said that fibromyalgia is a syndrome that is very misunderstood by doctors. It is a syndrome that is very misunderstood by family members, and it is also misunderstood by neighbors and friends. When someone looks at a person with fibromyalgia, they may appear to be fine, but in reality, they suffer and experience a significant deterioration in their quality of life. We know that fibromyalgia is accompanied by fatigue, malaise, depression, lack of memory, attention, concentration, as well as digestive disorders, and primarily muscular problems. Widespread muscle pain. This is what the World Health Organization refers to with those 18 sensitive points that we will elaborate on later. So we know that within the context of official medicine, they only focus on muscle pain, but the rest of the symptoms are also part of this larger syndrome known as fibromyalgia. Well, in this book, you can see what I was mentioning, which is a problem misunderstood by doctors, family, friends, and Dr. Manuel Martin Lavín developed this book where he talked about how fibromyalgia is precisely misunderstood pain. We will develop what the general considerations are, and we must say that fibromyalgia refers to a group of common rheumatic disorders, non-articular in nature, characterized by pain and stiffness, of variable intensity in the muscles, tendons, and surrounding soft tissue in all muscular structures of the body. No physical alterations have been detected in the specific painful points, which is why the most current hypotheses regarding its origin focus primarily on central sensitization phenomena at the level of the hypothalamus and the brain, which would maintain the pain due to alterations in the responses of neuropeptides or neuromediators. Although the result of the general physical examination is almost always normal, people, as I mentioned before, appear healthy and do not seem to suffer from this problem. However, a careful examination of the muscles of people with fibromyalgia reveals specific sensitive areas to the touch, known as hypersensitive points. These hypersensitive points are areas of the body that become painful when pressure is applied to them, and the presence and pattern of these characteristically hypersensitive points differentiate fibromyalgia from other types of rheumatological conditions. Let's look at the epidemiology. It is known that this disease affects women more than men, with a ratio of 9 out of 10 women, where 9 out of 10 may suffer from this problem, while in men it is much less common and could affect approximately 3 to 5% of the general population. We also know that there is an older age group with an average of around 50 years, but currently more isolated cases are being seen, even in children suffering from this disease. Let's look at the etiology. 2009. Fibromyalgia can be caused or aggravated by physical or mental stress, physical trauma, excessive exposure to humidity or cold, or also by poor sleep and suffering from a rheumatic disease. Although the causes have not been well clarified, some theories point towards a genetic predisposition, particularly highlighting research on the COM gene, catechol-O methyltransferase, and genes related to serotonin and substance P. We will see that serotonin levels are usually lower in these individuals, and above all, they tend to have considerable increases in substance P, which is the pain-mediating substance. In many cases, patients with fibromyalgia present low levels of serotonin and tryptophan. We know that tryptophan is involved in the neurotransmitters, that regulate nerve impulses, and there are significantly elevated levels of substance P, especially detected in the cerebrospinal fluid. A low level of blood flow has also been found in the thalamus, hypothalamus, and brain, along with an increase in pro-inflammatory cytokines. Many cases begin after specific events. Some of these cases have been linked to viral or bacterial infections, especially those caused by cytomegalovirus, distemper virus, Bowsend parvovirus, and Toxoplasma gondii. They can also occur after car accidents and sometimes due to psycho-emotional issues, marital separation, or problems with children. It can also appear after having diseases that weaken the body, such as rheumatoid arthritis and lupus. All of this does not seem to be the cause, but rather awakens a hidden anomaly in the regulation of the response capacity to certain painful stimuli. Anxiety and depression do not seem to be the cause of fibromyalgia. No. However, a person who is experiencing fatigue, weakness, and muscle pain may develop issues with anxiety and depression. Current theories on the pathogenesis of this disease include alterations in sleep architecture. For example, it has been observed that these individuals experience fragmented sleep, a decrease in deep sleep phases, disturbances in the functioning of the autonomic nervous system, and also phenomena of abnormal pain processing, leading to increased sensitivity to pain. Additionally, ultrastructural alterations have also been found in muscle biopsies studied at the level of electron microscopy in these patients, thus integrating certain theories that encompass the different and complex relationships between the mechanisms of sleep and wakefulness, that is, alterations in the circadian rhythm, alterations in the hypothalamic pituitary axis, adrenal glands, the processing centers of pain pathways, phenomena of central and peripheral sensitization of pain, and the autonomic nervous system with alterations in autonomic tone, sympathetic, parasympathetic, or sympathetic veil, with sustained hyperactivity of sympathetic tone. This condition is thus considered within a comprehensive model, a disease of the psycho-neuro-immunoendocrine system. There are descriptions in some cases of fibromyalgia where the clinical manifestations coincide with those of a viral infection, as I mentioned, or a bacterial infection, such as Lyme disease, which is a silent disease caused by Borrelia and can sometimes also lead to a problem of fibromyalgia. Recently, new research has begun to study different areas of the brain using more sensitive and advanced imaging and neurosurgery techniques. A strongly supported hypothesis by the scientific community suggests that fibromyalgia is caused by an interpretative defect in the central nervous system that abnormally perceives pain signals. What clinical manifestations, signs, and symptoms can we find in fibromyalgia? Well, fibromyalgia, as I have mentioned, causes widespread musculoskeletal pain, intense and even debilitating weakness, along with lethargy, sleep disorders, alterations in bowel rhythm, and digestive issues, stiffness in the upper or lower limbs, and very frequently depressive episodes accompanied by anxiety attacks due to the situation that these individuals suffer and endure. The most common sites where fibromyalgia occurs, those 18 tender points mentioned by the World Health Organization, can be found in the lumbar region, neck, chest, and muscles. Muscle impairment mainly refers to painful, highly localized cramps. In some cases, generalized muscle spasms are also observed. These sleep disorders are very common in patients with these conditions. These disorders mainly consist of frequent nightmares, night terrors, nighttime fears, and non-restorative sleep, which can lead to a condition known as daytime hypersomnia, as well as a significant amount of painful muscle spasms, particularly during sleep. One of the joints that often suffers a lot is the temporomandibular joints. That is what is known as bruxism. Other additional symptoms that we can include are urinary incontinence, headaches, and migraines. Abnormal periodic movements of the limbs, such as paroxysmal movements, especially in the legs, which we sometimes also refer to as restless leg syndrome or trigger leg syndrome, along with difficulties in concentration, trouble remembering things, lack of memory, attention, and focus. It is also common to find an increase in tactile sensitivity, which feels like a generalized tingling or burning sensation, dryness of the eyes and mouth, buzzing, sometimes in the ears, tinnitus, and occasionally the appearance of phosphonies at the level of the visual structures of the eyes. Regarding the diagnosis, we can say that there is no specific and concrete technique to diagnose fibromyalgia. There is no specific analysis that tells us this person has fibromyalgia. To diagnose fibromyalgia, the doctor must evaluate the patient's medical history, as well as the symptoms we have indicated, and these 18 tender points. According to the World Health Organization, if we press on these 18 tender points, and 12 of them are sensitive to pressure, this would provide a diagnosis of fibromyalgia. These tender points are distributed throughout the body at the level of the knees, shoulders, neck, buttocks, elbows, and hips. In any case, this criterion was initially adopted as a way to define fibromyalgia, which is why the diagnosis requires a thorough evaluation by a specialized physician, especially in rheumatological diseases, to rule out that it is polymyalgia or a purely rheumatological issue. As mentioned, there are no specific and concrete laboratory tests that tell us this is fibromyalgia, and the diagnosis will be clinical, established by excluding other pathologies and by the presence of characteristic symptoms and signs. Fibromyalgia is often confused with rheumatic conditions such as polymyalgia rheumatica and Sjögren's syndrome, which an experienced doctor can somewhat rule out as being related to fibromyalgia. In the context of integrative medicine and fibromyalgia, we can say that fibromyalgia may be the consequence of dysbiosis, an alteration or a disturbance of the balance of the intestinal flora. In many cases of fibromyalgia, we detect chronic intestinal candidiasis, and we know that the toxins resulting from this dysbiosis impair phase 1 and phase 2 of hepatic detoxification, increasing intermediate metabolites. This increase in intermediate metabolites raises oxidative free radicals, leading to a loss of energy. These intermediate metabolites that cannot be eliminated accumulate in the muscle. This alters the acid-base balance, producing tissue acidosis and blood alkalosis, leading us to this rich and varied symptomatology in fibromyalgia. Therefore, we must first address intestinal dysbiosis. In fibromyalgia, there is also a disorder in carbohydrate metabolism with hyperinsulinemia, meaning an increase in insulin. This leads us to hypoglycemia, which in turn leads to chronic fatigue. Therefore, we need to regulate the intestinal flora, balance phase 1 and phase 2 of liver detoxification. And with this, the patient will really feel much better. It has also been observed that in fibromyalgia, there is intestinal dysbiosis accompanied by liquid, meaning an increase in the permeability or porosity of the intestine. This causes inflammation at the intestinal level, and in fact, when you palpate the intestinal area, it is evident that the intestine is painful. And this will lead to an increase in interleukin-8, which carries the message to the macrophages. These reach the injured tissue and produce pro-inflammatory cytokines such as tumor necrosis factor alpha, interleukin-1, and interleukin-2. These nerve endings also receive this message and begin to start to produce substance P, which is the pain-mediating substance. This substance P produces widespread muscle pain, including joint pain, muscle pain, and also intestinal pain. Look, this would be the intestine. When there is an increase in intestinal progression, interleukin-8 will stimulate macrophages, which will release interleukin-1, interleukin-6, and tumor necrosis factor, leading to inflammation of the intestinal wall. Here, you can see that we have nerve endings, and this will release and produce an increase in substance P. Ultimately, this accumulation of substance P is what will cause these pain problems. In fibromyalgia, we will find an increase in substance P. Leaky gut syndrome, a significant increase in substance P in the upper and lower limbs, and in these 18 tender points, as well as in the thorax and back. All of this leads to a decrease in the thyroid hormone T, resulting in hypothyroidism. The levels of norepinephrine, which is a mediator of the sympathetic nervous system, will also decrease. Here we can use omega-3 fatty acids, which block arachidonic acid, reducing COS. This would decrease prostaglandin E, which in turn reduces inflammation, decreases substance P, and ultimately decreases pain. We know that omega-3 fatty acids, EPA, decrease NF-kappa beta, which is the protein that encodes the gene for pro-inflammatory proteins. Vitamin C also interacts by decreasing NF-kappa beta, and these are two micronutritional elements that we can use in these patients. Also within fibromyalgia, it is important to remember mitochondrial medicine. Mitochondria are the small power plants where we generate and produce the great energy molecule of life, which is ATP, adenosine triphosphate. And we know that through vitamin B, coenzyme Q, PQQ, and L-carnitine, we can stimulate the energy production that each of us produces and manufactures throughout the day, amounting to between 60 to 80 kilos of ATP. Look, when glucose enters the cell through the blood vessels, it needs to be phosphorylated through pyruvic acid, and pyruvic acid, in the presence of oxygen, is transformed into acetyl coenzyme A, which requires vitamin B as a cofactor. This is very important because we will use it as a therapeutic strategy. And through the Krebs cycle at the mitochondrial level, it generates 38 ATP, adenosine triphosphate. But if there is not enough oxygen, we have hypoxia. And this pyruvic acid is converted into lactic acid, which will accumulate in the muscles and cause contractures. Notice that if glucose follows this pathway, it will only produce 2 ATPs, which is why it is important to stimulate the pyruvic acid cycle through acetyl coenzyme A in the presence of vitamin Baucent to obtain precisely 38 ATPs. It should also be noted that the leukocyte formula can provide us with a lot of information. Notice that the neutrophils, which are normally shown in blue, are the macrophages and represent the first line of innate defense. We need to investigate through the leukocyte formula. If they are below the neutrophils, we have weakened defenses and innate immunity. If we have elevated eosinophils, this would indicate intestinal dysbiosis. If the basophils are elevated, it would indicate allergy problems. If we have elevated monocytes, this may indicate significant systemic intoxication, with an increase in circulating antibodies and antigen antibodies. And if we have decreased lymphocytes, this may potentially indicate that there is a serious problem with acquired immunity. Remember in this slide that it can provide us with a lot of information about both innate immunity and intestinal dysbiosis, whether there are allergy problems, and especially how acquired immunity is functioning. Well, through bacterial deamination, when there are digestive disorders, tyrosine, which is an amino acid that is part of proteins, is transformed into benzene compounds, such as phenol and kesol, which inhibit the enzyme 5' deiodinase. And what is this enzyme used for? We know that the thyroid hormone T, in the presence of 5' deiodinase, is transformed into T. But if we have too much of it, if this enzyme is inhibited due to substances from the metabolism of tyrosine caused by dysbiosis, poor digestion, or the arrival of insufficiently digested proteins in the intestine, this will lead us to a problem of hypothyroidism. And of course, this hypothyroidism will make us feel cold. We know that 80% of this conversion from T to T occurs in the liver and 20% occurs in the thyroid gland itself. The metabolites of tryptophan, when tryptophan is not properly digested due to a lack of digestive enzymes or digestive disorders, produce substances such as indole, which also reduce 5' deiodinase, increasing T and decreasing T, leading to hypothyroidism, which is commonly found in fibromyalgia issues. In 2001, carboxylent bacteria act on tryptophan in the descending colon, such as E. coli, Proteus, Bacillus, and fragile bacteria, which can lead to an increase in indican. When indican levels rise, it increases the conversion of tryptophan to serotonin, which can result in hypothyroidism. Also remember that these patients may suffer from hypochlorhydria, and if you do not have enough hydrochloric acid, you do not digest proteins well. This can lead to the presence of undigested protein remnants or fragments, first at the stomach level due to a lack of hydrochloric acid, and also due to a failure in the formation of proteases, lipases, and amylases at the pancreatic level. Look here at the level of the stomach. We have the G cell that produces gastrin, a hormone in the stomach. We know that when gastrin levels are elevated, they produce enough hydrochloric acid, which leads to good digestion. When gastrin levels are low, hydrochloric acid decreases, leading to poor digestion. It has been observed that caffeine stimulates. Having a little coffee from time to time stimulates the G cell, which increases gastrin, increases hydrochloric acid, and promotes good digestion. However, if too much caffeine is consumed, gastrin levels decrease, hydrochloric acid levels drop, which leads to reduced protein digestion. This favors the arrival of poorly digested protein residues in the intestine, which can also lead to hypothyroidism due to the poor conversion of T4 to T3 caused by the blockage of 5' deiodinase. Hypochlorhydria can be treated with magnesium, zinc, and vitamin B, which is the cofactor for the synthesis of hydrochloric acid. Thyroid dysfunction can lead to various issues, including carpal tunnel syndrome due to cellular growth motion, dry skin, constipation, and fibromyalgia due to decreased thyroid hormone T, slowness of thought, reduced memory, and difficulty expressing oneself, which means a range of problems associated with that thyroid dysfunction. Problems also in reproduction, gestational hypertension, thyroid nodules, and remember when we find that anti-hyperperoxidase antibodies are elevated, to think that there may be a problem of mercury poisoning. The cofactors of thyroid hormones that need to be supplied in these cases to produce more thyroid hormones are tyrosine, iodine, selenium, iron, zinc, manganese, vitamin E, vitamin C, and vitamin A. And remember that the hormone, monothyronine T, is 4 to 5 times more active than T. We have talked about fatigue and acidosis. Remember that fatigue problems are also closely linked to excess acidity. And we know that acidosis, when a person is acidified due to the consumption of acidifying foods, can lead to muscle pain, cramps, tremors, decreased exercise tolerance, sleep disorders, intellectual disturbances, sexual dysfunction, digestive issues such as diarrhea and constipation, character disturbances with irritability, hyperemotionality, relationship difficulties, somatic disorders, a lump in the throat, palpitations, and visual disturbances. It is important to remember that fatigue and acidosis can also be evaluated. One of the common causes of fatigue is due to the increase of lactic acid. This accumulation slows down glycolysis and therefore the production of ATP. This accumulation of lactic acid can lead to muscle contractures, a feeling of fatigue, abdominal pain, and digestive disorders. This fatigue is also related, though less commonly known, to the accumulation of pyruvic acid. We have previously mentioned that pyruvic acid requires vitamin B as a cofactor to produce those 36 molecules of ATP. So we can measure these levels of pyruvic acid to determine if that person is in a state of acidosis. Remember that we can also measure acidosis through urine. The first urine in the morning should be discarded, the second one mid-morning, the third one at noon, and the fourth one in the mid-afternoon. The average of the three should be around 7, 687, 7 with 2. This would indicate that we have a good geobasic balance, but if it is below 6.86, 5.5, it indicates that we have intense acidosis that can lead to the symptoms I have mentioned. Well, elevated pyroglycemia causes significant chronic fatigue, and we can treat it with vitamin B, specifically thiamine pyrophosphate, which is the vitamin B that primarily acts by regulating acid-base balance at the cellular level and more recently at the mitochondrial level. Fatigue and acidosis. As we mentioned, we can treat it with thiamine pyrophosphate, which improves resistance to nausea, enhances athletic performance, increases pain tolerance, improves tolerance to all types of aggressive treatments, alleviates issues related to candidiasis, and enhances the capacity for delay and attention. It is important to provide significant doses of vitamin B between 300 and 900 milligrams. Biological treatments can include ozone therapy, which is a therapeutic procedure that involves extracting blood, ozonating it, and then reinfusing it. There is also the option of zone therapy, which is also very effective, or ozone therapy applied to the specific points of pain that individuals with fibromyalgia experience. We also use oxythermia, which is a therapeutic procedure through which we raise the body's temperature to 39 degrees by breathing oxygen through a mask at 15 Elmin. With this, we induce fever in the body, and we know that fever is the most powerful immune mechanism we have to fight against many problems we suffer from today, including fibromyalgia. With oxythermia, we also increase the excretion of substance P through the sweat glands and through the sebaceous glands while we breathe in that oxygen. And what is oxythermia itself? As we saw earlier, we place the person on a stretcher, as shown in the diagram, and subject them to this increase in temperature. Oxythermia is a treatment developed by Professor Manfred von Arden in Germany and involves the general warming of the body. Throughout the evolution of medicine, heat procedures have been widely used to treat a multitude of problems. In this case, we can use very effectively and sensitively to address the problems of fibromyalgia. Hypothermia causes the body to reach 39 degrees and is one of the oldest therapeutic methods in medicine. One of the qualities of oxythermia is that it uses infrared light with a type of infrared rays that heat the patient but do not burn them. Infrared light is an invisible component of light, and we use it directly with a series of reflectors that impact the patient directly. Only infrared light penetrates the deeper layers of the skin without thermally loading the surface. This would significantly prevent the excessive heat felt with other heat methods. The heat created in the layers of the epidermis, specifically the horny and generative layers, is transported through the ocular system to the interior of the body, causing the temperature to rise in all regions of the organism. The vascular increase in tissues and organs is favored. It accelerates oxygenation, improves metabolism, and enhances organ function. It also decreases muscle tension by releasing those muscle contractions. It eliminates the faster removal of painful substances such as histamine and substance P, which results in a calming of that pain. It improves and stimulates the immune system. It reduces acute and chronic inflammation. The simultaneous inhalation of oxygen at about 15 Elmin also improves microcirculation at a general level, which in combination with heat creates a very beneficial state of tranquility and improvement in the overall muscular structure. Colon hydrotherapy is very important because nearly 70% of bacteria are located in the intestine. Cleansing, draining, and detoxifying with therapeutic procedures such as colon heliotherapy is also very effective in these patients. Notice that through colon therapy, we improve the sphincters, enhance venous return, address varicose veins, hemorrhoids, prostate area issues, constipation problems, digestive disorders, gas issues, muscle pain, hernia problems, asthma, and allergies. It is a therapeutic procedure that is very ancient. Even in the Ebers Papyrus, the Egyptians spoke of using enemas as a therapeutic procedure. Today, we use more comprehensive therapeutic procedures with more certified machines through what is known as colon hydrotherapy. You see how we know that a person who is extended generates self-intoxication from their own fecal matter, which has to be metabolized and transformed at the level of phase 1 and phase 2 of hepatic detoxification, and this overloads the working capacity of our liver. It should also be noted that a new concept has been introduced today, which is quorum sensing, the quorum sensei. This means that at a certain moment, a group of bacteria, parasites, and pathogenic fungi begin to increase, and when what is called quorum sensing reaches an adequate concentration, they start to organize, they begin to translocate, and there in the tissue where they arrive, they start to generate the specific and concrete pathology. Hence the importance of not allowing the person to be extended. Procedures such as colon hydrotherapy are highly recommended in these cases to prevent quorum sensing, which, when it reaches such an important concentration, begins to generate pathology. Therefore, a preventive treatment for many pathologies would be to avoid this quorum sensing. A new concept has been introduced, which is generalist gut flora and specialist gut flora. It is important to strive for a variable gut flora to prevent specialists from dominating, and this is achieved through good variability in nutrition and diet. Generalist gut flora are bacteria that can perform many functions. However, specialist gut flora can only perform one function. Therefore, we must insist on stimulating the generalist gut flora because it does not harm our body. However, the specialist gut flora does. The more different nutrients you consume, the more generalist gut flora you develop, and ideally, you should consume between 100 to 150 different nutrients per month to achieve good variability in your gut flora and thus avoid this specialist gut flora. Specialists become pathogens through a phenomenon of self-induction, translocate to specific tissue, and there they generate pathology. The generalists, however, do not have this phenomenon of self-induction and do not transform into pathogens, but rather into saprophytes, good and friendly flora. So this self-induction is essential for the behavior of the phenotype of our gut flora. Notice that generalists have been found to be dependent on both meat and fish. It is important to eat meat from time to time. I'm not saying we should eat meat every day or fish every day, but we do need to incorporate meat into our nutrition and our diet because we are dependent on meat and fish. That is to say, animal food also has a certain influence on the development of gut flora, more than was previously thought. Notice that the Juza have a great variability in their gut flora. The Malawi do as well. And the Burkina Faso also show quite a bit. The Italians already have less variability. In the US, less variability. England, less variability. I believe we are between the English and the Italians. But look at the great variability of bacteria that these peoples have. The Hadza, the Malawi, and the people of Burkina Faso. This is what interests us, to have a great variability of gut flora in order to maintain a healthy intestine. Look, when a group of bacteria reaches quorum sensing, like Helicobacter pylori, it can lead to stomach cancer. The Staphylococcus mutates when it reaches that quorum sensing and can produce breast cancer. The persistent Fusobacterium nucleatum, when it reaches that quorum sensing in the colon, note that this bacterium is a normal resident of the mouth. But when it reaches a significant concentration in the large intestine, it can lead us to colon cancer. For this reason, in 2021, colon hydrotherapy is highly recommended in these cases to eliminate this group of bacteria that, when they reach a certain concentration, can generate pathology. These are 3 examples, but normally this example serves for the major pathologies that we suffer from in the present. Also, magnesium injections. There is a preparation, the German magnesium Berla, that can be administered intravenously and is fantastic because it quickly reduces muscle contractions. I recommend this one because the types of magnesium we have in Spain, I would not use. This one is very well prepared for intravenous administration. Vitamin B injections, 0.5 cubic centimeters. In the skin, in the trapezius area, also help these patients eliminate the state of sympathetic tone that they suffer from. Macronutritional treatment of fibromyalgia. Remember an anti-inflammatory diet, avoiding white bread, white rice, pastries, baked goods, potatoes, pizza, pasta, and sugars in general. We must try to avoid inflaming the intestine to prevent the production of liquid, to prevent the production of interleukin-8, and to avoid a significant increase in pro-inflammatory cytokines. Now, let's talk a little bit about gluten. Avoid dairy products and derivatives. Eliminate refined foods. Remove saturated fats. Reduce the intake of legumes to 1 or 2 times a week to avoid the intake of saponins, and also avoid mammal meats due to a histocompatibility antigen known as NeoGC. Gluten, note that it is a peptide of 33 amino acids, and the pancreas can degrade it into 3 fractions through proteases: alpha-1 gliadin, alpha-2 gliadin 9, and alpha-3 gliadin 9. Next, these gliadins must be degraded into isolated amino acids, and these are broken down by dipeptidyl peptidase 4, which is capable of digesting gluten. Dipeptidyl peptidase 4 is produced in the epithelial cells of the intestine. Gliadin is rich in proline, which is located at positions 2 and 46 of the protein. And we know that dipeptidyl peptidase 4 can cleave where proline is present, converting gliadin into XP and PNTPs. That is 2 dipeptides and 1 tripeptide. And this tripeptide TPS is the one that inhibits dipeptidyl peptidase 4. So, if you eat little gluten, you do not inhibit dipeptidase 4. But if you eat a lot of gluten, you will inhibit dipeptidyl peptidase 4. And we know that dipeptidyl peptidase 4 is the enzyme that cleans, drains, and detoxifies substance P. So, if you are smoking cereals that contain gluten, the etidyl peptidase is working on the gluten and not on substance P. Therefore, celiacs cannot consume more than 50 milligrams per day, while non-celiacs can have a maximum of 4 grams per day. There are 3 proteins in nutrition that are broken down by dipeptidyl peptidase 4, which are gluten, casein, and protease-resistant proteins, such as pork and red meats that are grilled or cooked on a griddle. And we know that the pig is the only animal that has raw amino acids, and our own amino acids are L amino acids. One of the ways we have to transform meat from amino acids is the microwave. The microwave converts proteins into protease-resistant forms. All of this, gluten, casein, and protease-resistant proteins, can cause migraines, angioedema, cardiovascular pathologies, autism, and fibromyalgia. And it should be remembered that substance P is behind many pathologies such as Alzheimer, neurodegenerative diseases, and angioedema. Therefore, if you want to keep substance P levels low, you should try to avoid cereals so that dipeptidyl peptidase IV can work on that drainage, that cleansing, that detoxification of substance P, which is the pain mediator. Notice that when a person is acidified, substance P is generated through stress, and when someone is acidified, trimers of substance P are produced. Indeed, these are trimers of substance P, and this actually has a neurotoxic effect and produces significant inflammation at the level of the hypothalamus, resulting in that neuroinflammation. This generates the problem of central sensitivity in the brain, and this ultimately leads us to pain. Therefore, it is very important to also remember to regulate that acid-base balance. I will skip this for now, because otherwise we won't have enough time. Micronutritional treatment of fibromyalgia. As we have mentioned, providing dietary nutritional supplements based on magnesium. You know that there are many forms of magnesium, galenic forms. It has been observed that magnesium biglycinate is a very effective form for absorption and assimilation, with a high bioavailability of this mineral that helps relax muscles, but also participates in each and every biochemical relationship involved in the formation and production of energy. Digestive enzymes to prevent undigested residues or protein fragments from reaching the intestine, probiotics, prebiotics, citrates, alkalizers. We can also use 5-HTP if the person is very acidic, and we will see why, to increase the levels of tryptophan and L-tyrosine, which is the precursor of dopamine. Dopamine gives us drive, strength, vitality, the desire to develop projects, attention, and concentration. But its precursor amino acid is L-tyrosine, which transforms into dopamine in the presence of iron, liposomal curcumin, to reduce inflammation. Omega-3s, as we have seen, inhibit NF-kappa B, which is the transcription factor that produces the increase of pro-inflammatory cytokines, glutamine, and the lion's mane mushroom. The addition, which consists of 2 preparations that help us repair intestinal permeability, Boswellia serrata to reduce inflammation. Coenzyme Q, along with B vitamins and PQQ, stimulates energy levels through those small power plants known as mitochondria, L-carnitine, and microencapsulated oregano oil, in case we have issues related to intestinal candidiasis. The PE, now I will give a few brief notes on PE, vitamin D, medicinal cannabis. This type of conventional TT supplements can improve the quality of life for our patients. Instead of using tryptophan to increase serotonin, it is better to provide 5-HTP, because if we have inflammation in the intestine, we have inflammation at a general level. This causes a diversion of tryptophan through the indoleamine pathways, so tryptophan does not convert into serotonin, and serotonin does not convert into melatonin, which we know. These patients suffer from and experience sleep disorders. Well, if we take 5-HTP, we bypass the ADO pathways and it goes directly to serotonin. But the same happens with L-tyrosine. In morning breakfast, we should provide a protein to allow L-tyrosine to enter through a protein so that it can be converted into dopamine. Dopamine will give us drive, vitality, the desire to develop projects, attention, and motivation. And remember that excess refined carbohydrates and stress or cortisol or type 2 diabetes can also divert L-tyrosine to another pathway of the Krebs cycle through tyrosine aminotransferase, thereby hindering dopamine production. Remember PIA, this is a preparation. Palmitoylethanolamide is an endogenous fatty acid that belongs to the class of nuclear factor agonists. It has many functions, and being prepared, it can help us in a very direct way to reduce the pain that these people suffer and endure. Notice that the function of conventional analgesics and anti-inflammatories is directed towards the effects of the central or peripheral nervous system. However, the function of palmitoylethanolamide, PEA, focuses on the deactivation of neuroglial cells, responsible for the presence of these pro-inflammatory cytokines that maintain pain. This generates an anti-inflammatory and analgesic effect via the peroxisome palmitoylethanolamide, PEA, then decreases the production of pro-inflammatory mediators such as TNF-alpha and pro-inflammatory interleukins by modulating hyperactive inflammatory cells like mast cells. In chronic situations, the body's cells do not produce enough palmitoylethanolamide, PEA, and this deficiency can result in pain associated with various pathologies. In summary, palmitoylethanolamide, PEA, inhibits the release of immune mediators from mast cells related to inflammation, as well as the number of mast cells themselves, making it one of the most effective options for endogenously produced pain, reducing inflammation and, in some circumstances, thermal injuries such as itching. What are the described uses of PEA? Well, chronic neuropathic pain and painful conditions, sciatica, migraines, and especially fibromyalgia. You have here a very effective therapeutic resource to relieve these pains in these individuals. So, PEA, which is palmitoyl ethanolamide, is a cannabimimetic, meaning it mimics the process of CBD in the body. The authors argue that it could even be considered a better alternative to cannabinoid products derived from hemp because it is a unique molecule and therefore much easier to measure in precise doses. And nothing more. Thank you very much for your attention, and I hope that this presentation can be useful and beneficial in addressing and alleviating the problems associated with patients suffering from fibromyalgia. Well, that's all. See you later.